Sir, how are you?
I'm good, man.
Sir, today we would like to ask you some complication in your field.
Yeah,
What you
sure.
encounter the complications in your field. We will not gonna ask you about your field, how it works. No. Today we will ask you about the complication that you encountered during your 25 or 26 years in your field.
Yeah, thank you so much, dear. As you know that I am the clinical perfusionist, or in some centers, like in some country, people used to say cardiac perfusionist.
Yeah.
So I have almost experience like a 25 to
26 years, yeah.
26 years in the clinical perfusionist as to working in this field. So,
even you serve as the chief cardiac perfusionist.
Yeah, I was the chief cardiac perfusionist in Aga Khan, very well known Aga Khan University Hospital, Karachi,
Yeah.
Pakistan. Then I work in UK in a Freeman Hospital. Then I work recently. I'm working here in Hamad Medical Corporation.
You're working here as in?
I'm working as a senior clinical perfusionist,
Right.
plus a lead educationist in perfusion unit. So
Oh.
your question is that
My question is like, yeah, according to your experience, what troubles you encountered during your
so there is a huge number of the trouble like incidents happening in my era during my clinical expertise. So one of that
would you like to share?
I will go one by one, and it is like if I'm going to start to talk and going to explain, it
will be a
huge number.
Any specific,
and
like
so
you
I will try
to
to tell you some few like naughty and still rememberable some incidents which happened in my life. I will start in the beginning of my life. I remember when I was in a training as a student perfusionist, and I was at the time of my clinical attachment. I was in a hospital with my senior perfusionist, and I remember when I was a student, and on that time, there was an oxygenator, and with the oxygenator you required some a heater cooler machines with the silicone pipe, with the pipes which keep the blood warm and cool. So on that time we don't have the metal coupling like holders to which we're going to fix with the oxygenator, but we are using the that time was like in a 90s time, so we are using the like in 95 96, I remember that was the time. So we're using the tubes. So my chief used to use that the PVC tubes which was connected with the heat exchanger. So what was happening the time of when the surgeon was harvesting the internal memory, so he used to sit on the on the stool, and we prime our machine, huddling machine, and just keep behind, because our machine, the setup was that our machine was behind the surgeon. So what is happening usually when he harvests the internal memory, and when he move and change the positioning of his stool where with him he was sitting, so sometimes that the wheel of the chair or stool with on which my surgeon was sitting, it stuck with the tube which is coming from the heat exchanger, the water line, and it pull out.
Really?
Oh, and all like in a liters of water just
starts coming out.
Oh, it fell on the floor, and even he get wet with the socks get wetted, and he starts shouting, who is that? Wow, did this? And my senior, what he used to see, he used to say, oh, our junior did this, and then
always blame on the junior.
Of course, I was a student. So the surgeon started blasting on me, and this time passed, and he said, you are not fit for as a perfusionist, please change your field. Then every time, because I was not the culprit actually, culprit was my senior.
But of course you are the junior, so you have to be
here. I was keep quiet. And then the surgeon used to say, please change your field, you are not the suitable perfusionist, you are not the fit for this type of profession. So I'm always say, sorry sir, sorry sir.
One thing I would like to suggest to the senior doctors, or not only the doctors, like everyone in this field, not in medical field, everyone in the field. Like, you are the senior, you have to respect your junior.
No, but
because
I'm sorry, sir. My talk is still continue. So what happened? I will give you a chance to talk. Now is opposite now. I'll start talking.
Okay.
And this is my. Otherwise, I'm going to forget all the scenarios. So the time passed. I get graduated. I went for my examination in UK by Aga Khan University Hospital. I get a certification from I'm the first certified cardiac perfusionist from Aga Khan University Hospital as a diploma holder, and then I become the perfusionist in Aga Khan, and then I promoted as a senior perfusionist. The time passed, and I become a chief perfusionist in the same hospital from Sweden University Hospital, from where I get trained. So this surgeon time being left for USA. So his surgeon left for the USA, and after almost like 10 years or 15 years, he came back as a visiting surgeon
Really?
to the same hospital.
And he met
university.
you.
And Lala. So I get information that XY surgeon is coming back, and he will going to visit our hospital, and he will going to start this surgeries. And on that time, I was the chief perfusionist of my unit in Aga Khan University Hospital, Karachi. So I used to say, even we have the training badge also going on. So even we have the juniors. So I told to my juniors, my subordinate perfusionists, that see, XYZ surgeon is coming. In my training period, this person always get a problem that as a perfusionist, when he was harvesting
he always pissed off from UK. You are not getting
his socks get wetted, and this time please don't do this type of thing, because he will say, oh, this is
I already told you, you are not fit
so
for
I told to my juniors who was going to run the bypass, I said, don't do anything, try to be a competent, to show my senior most consultant that we are very competent here. So on that time we are using the tubes, I just told you, but now we have the proper metallic couplings, which
everything is according to that.
So what happened, everything is ready, and he primed my junior primed the circuit, machine is ready. One of our surgeon was harvesting internal memory, our heart lung machine was behind, and you know, in a heart lung machine we have the oxygenator and we have the cardioplegia delivery system, where we need also to hook the water lines to keep the cardioplegia cool and warm. So by mistaken, the perfusionist who was assigned there, he forgot to hook the cardioplegia water line.
Oh my God.
So once this surgeon knocked the door of operating room, and he says, Salaam alaikum, hi everyone, how are you? The same time, my perfusionist who was assigned there, he just pressed the button of the heater cooler unit and even the cardioplegia to cool the cardioplegia, and the water, the pipeline was not connected with the device. So what happened? The water sprayed the whole area, and he said, oh my God, after 10 to 15 years, you still are in the same page. There was no change in the life of the university, this hospital. So I feel very regret, because we are competent, we are fine, because we didn't go through with our checklist. They overconfident that we are doing great. So my message is, do your pre-op checklist.
No, but I think that was not your fault even. That was because of the surgeon. The first impression he gave you is to, like, you people are scared.
Yeah.
So when he came back, you people are in the same phase that, oh my God, he is coming, this happened.
I was in the same phase.
So that's why this thing happened. If that time your surgeon did not scold you and he calmly said, oh, it's okay, no problem, then this will not happen.
Yes.
But because of our great seniors, they feel that they are everything, then everything, these things happen. As I am myself a doctor, I'm a doctor. For me, I'm not a god. My team is everything for me. It includes nurses, nursing aid, everyone is as equal to me, because all they are learning by their hands. So my you know how to say, like, so my suggestion to other seniors, to just respect your juniors, because they are in a period
we need to give them
you
some
have to because not everyone is right here. You are the right, you have to teach them with all your love, because love make things okay.
And then I need to tell you one thing more. There is one more recent, like last year, incidents happened with me here, and it was very interesting actually. It is something like a horror movie.
Oh, really?
I feel like a horror movie.
Yeah, do you people encounter any ghost in your field?
No, I will tell you the story. This is look like something ghost came. This is a horror movie. You seen in a horror movie, suddenly you see blood, something. Similar this happened. this was routine adult bypass surgery. I was the assigned perfusionist with very senior most one of my here in a Qatari surgeon, cardiac surgeon. So we are running I was the one who's doing the bypass. So I primed the circuit, everything is fine, ready to go. We ready, we just go for the bypass. Bypass started. We run the bypass first 5 minutes, everything is fine, pressure's fine, parameters fine. How's your bypass? I said, yeah, perfect, excellent. And then he flushed the plegia, we flushed the plegia, hooked the plegia with the system. And meantime, what I noticed, and at the same time, one of my senior most, my colleague, who was the chief head of the department, he was standing with me. She was standing with me, and I saw suddenly, see, we have the heart lung machine, the big, and we used to sit and we operate the machines.
Okay.
We take a blood, purify, return back to the body, and surgeon is used to work on the heart.
On the heart, yeah.
You know what happened? Suddenly, I noticed on the floor, under from my heart lung machine, blood is coming slowly, slowly. It was similar like if you are in a movie and the horror movie and you see the blood is coming
out. Oh my God.
And there was no change in my parameters in heart lung on the patient's parameter, fine. My heart lung machine's parameter was fine, and there was no change in cardiopulmonary bypass. Everything was perfectly fine.
Oh.
But the blood
start coming up
slowly coming, and is coming under from the basement of the heart lung machine toward me.
Oh.
I surprised, and even my senior colleagues, she's surprised that everything is fine. There is no change in the level of the reservoir.
Everything is fine.
Level reservoir was fine. There is not if something happened, your level of the reservoir dropped.
Yeah.
Everything was fine, but I
From
was
where it's coming
confused from where this blood coming from the floor. Then I didn't inform to the surgeon because everything was fine going on, and I would just start looking and trying to find out where is the problem happening. You know what happened? The time when we gave the cardioplegia, there is a needle we inserted, and then the bifurcations came. One line we cut a hook with that needle, that cannula that we are giving the cardioplegia, and from other we suck out. And when we suck out from the body, the heart stop, everything is fine. Heart stop, everything is fine. Patient stand still, mean pressure 70, everything was fine. And when I start sucking from the vent, you know what happened? The end of the vent tube was not hooked with the I hooked properly. I remember, I don't know what happened, it would dislocate from the reservoir, and it come under the wheel of the heart lung machine. So when I start sucking slowly from the heart, it was sucking, but it is not going into the reservoir. It is going on the floor. And there is a huge blood coming slowly toward me. And I didn't notice that my tube was the 1/4 tube which is coming from the heart and going through the vent, aortic root vent, is not hooked with the cardiotom reservoir. So it was something like 1 or 2 minutes. It looked like it is something horror. I was surprised that my everything is fine, my machine's fine, the parameters fine. From where I'm getting this blood? So this is one again incidents, a very interesting incidents which I will never forget.
That's really interesting. Yeah. So thank you so much for your rest. We will continue in our second podcast. So thank you so much for your time. And any suggestion would you like to give?
For my juniors, for my colleagues, for the students. So even whenever you sit in the aircraft, although you did so many huge journeys experience, but every time the aeroplane staff always start
show you
the checklist of the pre-op checklist of the travel. Similarly, we have the checklist of prior to going to bypass. We have the checklist, so we need to go through with the checklist, so minimize the incidents going to happen during the cardiopulmonary bypass.
Exactly. Thank you so much. But still, we are humans. We do make mistakes because we are not robots. Yes. So if there is something happen, nothing to worry about. You are a human.
Yes. But in that type of scenarios, you should don't get panic.
But just
Be
relax, it's
calm, cool,
okay.
and
Yeah, something
your
happens.
reflection should be smarter.
Yeah, exactly.
Your mind should start working. And don't start panic and by going
So according to you, just relax for a moment. It's okay. This is happens now. You can't do anything.
Yes.
What you have to do is find out the error and
Yes.
solve it out. If you cannot, then everything will be just popped up. So make yourself calm.
Yes.
And everything will be fine.
Yes.
Thank you so much for your time. Have a nice day. We will come back with another podcast that will be the same but in a second
With
part.
with a different incidents.
So do like, do share. Thank you so much, sir, for your great time. Thank you.
Thank you so much.